Hi, we're here with Dr. Dale Patterson, Memorial's Vice President of Medical Affairs. Thanks a lot for joining us today, Dr. Patterson.
Glad to be here.
We've recently started at Beacon easing into more surgeries after several weeks of being a little more restrictive. Can you tell us what is our current plan?
Our current plan is to offer as many services to our patients as we possibly can, given the current restrictions with the pandemic. The government has relaxed the restrictions, and we have more personal protective equipment available for our associates to be able to protect them and our patients. And pretty much we can do whatever a doctor feels that a patient needs at this point. We want to start offering those services again.
Okay, what do patients need to know before they come in? Is there anything in particular they need to do, or what should they know about what we're going to do for them?
Yeah, patients need to recognize that things are different than they were in January before the disease first showed up in our area, and we're doing things to protect them and to protect other people in the hospital. So before they have their surgery, we will ask them to get tested most likely for COVID, and 3 days before their procedure, we would have them do that. And then during that time between when they're tested and when they come to the hospital, we're going to ask them to stay home so that they don't get exposed and they don't potentially bring the disease with them to the hospital.
Why are we able to do this now? Why are we able to ease up and allow more surgeries to take place? What's changed?
So a few things have changed. The one is that in the past we did not have the protective equipment available, and we had to really restrict what we were doing in the hospitals to preserve that for care of patients who had COVID. We have more equipment available now, and we're able to do more because of that. In recognizing that, the state has relaxed the restrictions that were in place because of the PPE restrictions. And then third, we've really seen that we didn't have the spike in cases that we thought we might have at this point, and we don't have the volume of patients in our community with COVID, fortunately, that some other places have experienced, and we're able to provide services to other patients.
How will we continue to keep patients safe? They might be wondering that when they enter our facilities, what measures we have in place. Can you describe those for us?
Yeah, things look a lot different now than they did a few months ago. When patients, what they should know is when they come into the hospital, we're doing something called cohorting, where patients who are known to have COVID are in a different area of the hospital and kept separate from patients who do not, in order to minimize the exposure and the risk of infection to patients who don't have COVID. We're also screening visitors at the door and limiting who can come into the building. So people who come in for surgery are only allowed to have one person with them who's going to be their ride home, or who will stay until they're done with their surgery and then leave. And our inpatients don't have visitors right now because we want to limit the chances that we're spreading the disease within our walls. So it looks a lot different in the hospital. There's a lot less people around because we don't have the visitors, and our cafeteria is not open to sit at a table and eat, and it looks a lot different than it did in December and January.
And finally, if someone's wondering or questioning whether they should seek out surgery at this time, what would you tell them?
I would tell them to talk to their doctor. Not a lot of reasons why you shouldn't have things done, but the people I would be concerned about in particular would those who are at high risk of complications from COVID-19. So patients who are older, who have significant health concerns or chronic illnesses, should talk to their doctor and see if this is the right time for them to have that procedure. Some things can wait, and we might be in a better position for them to be safer in the future, and other things can't, and they should still have those things done now. For most people who are at low risk and need to have something done, there's no reason that they shouldn't talk to their doctor and go back and see if now is the time to have it done.
Perfect. Thanks so much for clarifying and for your perspective today.
All right, you're welcome.